Welcome everyone to another episode of hashtag CRA Arthritis. Today we're going to learn more about the long and winding road to adult arthritis care. And we're really lucky joining us today, our good friends of ACE, Dr. Michelle Batthish. She's a pediatric rheumatologist and researcher at McMaster University who focuses on improving education, skill building, and experiences for youth with arthritis as they prepare to transfer from pediatric rheumatology care. And her colleague and our friend as well, Dr. Karen Beattie, who brings extensive expertise in research methods and patient and family engagement, helping people with lived experiences as patients or caregivers become active partners in research and care. Together, they're producing really leading edge research, practical tools, and real life guidance to help teens and young adults make the move to adult arthritis care, including, I must say, a prodigious number of poster and abstract presentations at the upcoming CRA meeting. Dr. Batthish and Beattie, welcome to the show.
Thanks for having us.
Thank you, Kelly.
We've got a number of studies to go through, so I'm going to dive right in, Dr. Batthish, and start with one that looks at mental health screening and how mental health can be identified and supported in routine care. So the first question I have for you, for our viewers and listeners, is why is mental health such an important part of arthritis care for youth?
It's a great way to start, Kelly. I think mental health is quite important when we look after anyone who has a chronic illness. There is a lot of data to show that those who are living with arthritis, especially children and youth, have a higher prevalence of mental health concerns such as depression or anxiety. We also know that there's this bidirectional relationship whereby if your disease is active, that can have an effect on your mental health. But we also know that if your mental health is not ideal or optimally looked after, that can have an effect on how your disease is being managed. So it's really important to be able to identify those youth who are at risk or exhibiting any type of symptom of depression or anxiety so that we could provide them with the right resources.
So from a model of care perspective, the study showed that simple screening can be built into regular clinic visits. What difference can that make for patients and families?
I think that it has huge implications. As pediatric rheumatologists or adult rheumatologists, we see our patients probably more frequently than they see their primary care provider. And so it is a great touch point for us to be able to assess if they are struggling with their mental health. So being able to introduce a very simple screening tool that could be added to our routine care can provide us with the opportunity to identify those who may be struggling so we can intervene sooner.
Our viewers and listeners have heard ACE talk about, based on national survey results, that at appointments, people with arthritis report that they often don't have an opportunity to talk about things like exercise, sexual health, or mental health. What should youth or parents do if they're struggling, but no one's asked them about mental health at their appointments?
I think the ideal state is that all clinics institute some form of routine screening so that it's not up to the patient or their caregiver to bring it up. That is just automatically asked at every visit. However, in the meantime, I think, and I would hope that patients, caregivers feel supported enough that they could openly ask their provider questions about their mental health, ask about resources that they may know of to get support that they need. And that doesn't necessarily mean to their pediatric rheumatologist or adult rheumatologist. It could be any member of the healthcare team, whether it's the clinic nurse or the physiotherapist that's in the clinic as well.
Thank you for sharing that, Dr. Batthish. I'm going to go to a second study that you're presenting, Dr. Beattie, and that's about parent stress and disease activity. And that's focusing on how family stress affects disease outcomes. Your study shows that parent stress can actually influence how a child's disease shows up. Can you explain that to our audience in sort of lay-friendly terms?
I will try my best because these were results that were a little bit unexpected to us, and we're
Hmm.
still working on trying to figure it out. But that's what science is all about. So what we do know is that, as Dr. Batthish alluded to, that mental health can certainly impact disease activity. And yes, we recognize there's this bi-directional relationship. What we've understood less in the pediatric world is how the stress of a parent or a caregiver can potentially impact a child and a child's mental health, and how that in turn, either directly or indirectly, can affect the child's level of disease activity. So our results did demonstrate that yes, when we measured what we call some internalizing factors, which, as Dr. Batthish alluded to, were the anxiety, depression, even the social isolation, that yes, those feelings that were stronger in children did show up as higher levels of disease activity. We also measured parents' levels of stress. And those results also showed that higher levels of parental stress were associated with higher levels of disease activity in kids.
Hmm.
Where we were a little bit confused is where we look at kind of the intermediate effect of the parent's mental health and the child's mental health on the child's disease activity. And what we found there was that in parents with a lower level baseline level of anxiety and depression, there was a stronger relationship between the child's mental health and their disease activity. This wasn't necessarily what we expected, and so we're still trying to figure out exactly how to explain it. One of the things that we'll look to do is to analyze these data again in a larger sample. We're not finished that study yet, and see whether or not those results persist. And then if they do, it's something that we need to really look into further. Is it perhaps that parents are masking mental health issues when their children's disease activity is very high? Because they need to cope and get through the day. Those are things that we'll need to tease out, and we'll certainly use our family partners and our lived experience partners to help us understand what those data really mean.
So further research, I guess this question maybe it would be included there in terms of your exploration, and that is, I'm wondering what it means for families, especially parents who may already feel overwhelmed, anxious, guilty, and depressed. What can you, at this point, provide insights around what it means for them?
I think opportunities like this to help people understand that this is what our data show, that this is not uncommon, helping parents and caregivers not feel alone, and that if they are feeling this way, this is what we see, not just in children with arthritis, but as Dr. Batthish alluded to, in children with other chronic health conditions. I think there's a couple of things, speaking from lived experiences. I think parents who feel overwhelmed and guilty or have other feelings of stress need to help their own primary care physician understand how their child's illness and chronic condition can affect them, and seek out help and support. If they don't have a primary care provider, there are peer support networks that are available. Talking to other families, I think, is a very, very profound way to understand that you're not alone and talk through some of those potential strategies. And I think talking to your child's pediatric rheumatologist is also really helpful. This is something that they hear, and that the more they learn about and understand, the better equipped they feel to be able to provide support and education for families, to be able to either normalize something or to be able to get on it and help.
Thank you, Dr. Beattie. I want to continue the theme of information needs and information gaps in young people with arthritis. And in particular, I'm referring now to this third study where you both look at how youth feel underinformed about real life risks like alcohol or drug use or abuse. Dr. Batthish, I wonder, your study shows that many youth feel poorly informed about alcohol, drugs, and most importantly, their medications. I guess that would come as a surprise to a lot of people. Why is there such a big gap in care?
So first of all, I think we have to appreciate that youth with a chronic rheumatic illness like arthritis are no different than any other adolescent who is starting to explore things like alcohol, drugs, reproductive health, and so on. So we need to appreciate that first and foremost. Then you add a layer of complexity that is their underlying illness, and then the medications that they take, which can potentially interact negatively with alcohol or other substances. And so these youth need that extra layer of information to help them understand the potential risks associated with certain exposures of alcohol or other substances. Clinics are very busy. So when they come to see us, we are often focused on their disease status, reviewing their medications, making sure they're getting their blood work in a timely fashion. There may not be time to address other things like their reproductive health, potential uses of different substances like alcohol, nicotine products, and so on. So I think this is something we need to be aware of so that we could figure out a way to seamlessly incorporate this in our regular clinic visits.
So they're asking questions and finding it difficult to get answers to some of these questions. What would you say to a young person who feels uncomfortable bringing up topics like alcohol, sex, or drugs with their doctor, their specialist? What sort of tips or advice could you give them?
I think one first step as the clinician, we need to ensure that they are in and they feel that they're in a safe environment. So one simple step is with any youth that we at least start the clinical interaction with them alone in the room, because these are conversations that they may not want to have with their parent in the room at the same time. And to ensure confidentiality and make sure that they understand the limits of confidentiality. After that, I think having resources available at their fingertips, whether it's in the clinic room itself, whether it's on a poster or QR codes that they could scan, ensuring that they have the information ready for them. We do know, though, that from the study, a lot of the youth who responded want that information from their healthcare team. They would much rather hear it from us than go to some website or some other forum that's online. So as long as we can ensure that safe environment and have them feel comfortable coming to us, and then equipping the clinical team with the resources so that they could provide the accurate information to them would be ideal.
Thank you for that. I'm now going to shift focus to two more studies that you are also presenting, and that is around that road to adult arthritis care that I referenced in our introduction, that you both are experts in. And the first study that I want to look at, Dr. Beattie, is about transition readiness. How ready youth feel for adult care changes over time. Your study presents. And I'm wondering, first of all, for our audience, what does transition readiness actually mean for a young person living with arthritis, and why is that so important?
I think it's a kind of catch-all phrase that we use to represent self-management skills and level of independence. Essentially, are you ready to transition to adult care? The question is, what am I trying to get ready for? And in an adult world, you're trying to get ready for appointments that are focused on you as the youth or the young adult and not necessarily your whole family. It's an environment where there is kind of an expected level of independence and ability to manage your own care, whether that's medications or how to manage a flare, etc. And so this kind of are you ready for it? How ready are you for transition? Is something that we as scientists love to measure because then we can measure change over time when we institute something that we think will help. And so there are different tools that can assess how ready someone is for transition. At McMaster, we use something called the transition queue. And it's a 14-item questionnaire that asks a whole bunch of questions about how independent you are and how often you perform those tasks independently. So, for instance, how often do you ask your provider questions on your own without a family member present? How often, or are you able to contact a healthcare provider if you need to talk to one? Do you do that on your own or do you need some help? And so when we can measure it and we can potentially score it, we can use that to understand where is this youth or this child currently at? How independent are they right now? And where do we need to help them get to by the time that they transfer to adult care?
So your study shows that readiness improves over time, encouraging, but not equally for everyone. So what are some simple real life things that youth and parents can do earlier? And I'm thinking, even at the early ages of 14 or 15, to help build up that readiness.
There's a lot that you can do, and I think part of it starts with understanding kind of what is the end goal. I would like to be able to do what, or to be able to manage what. And you can have those discussions with your providers. What will the expectation be, and how do I get there? We know from our data that there's a lot of variability in kids who are 14 and 15 about where they're currently at. There are some 14 and 15-year-olds that are quite independent and able to manage things on their own. And there are some 17-year-olds who are, not nearly as independent as some kids who are younger. So what we know and understand is that this has to be a very individualized approach, and everybody's on their own trajectory. We start by assessing where are you currently at and how can we improve that from wherever we start. We know from the data that boys traditionally aren't as ready as girls who are of the same age. And that's not at all surprising because we know that brain development in males and females occurs at different rates and at different times. And we know they all get to the same point, but not necessarily on the same trajectory. And so we know that boys may need a little bit extra support at the same age as girls. But we know that there's a lot of variability. So a 15-year-old boy, we can't assume that they have a certain level of independence or self-management skills because they're a 15-year-old boy. There are 15-year-old boys who have higher scores than others. And that's a really important consideration that needs to be made, recognized by parents. Don't compare your kids to other kids, and recognized by physicians and healthcare teams that this is where we're at. We're not going to look at how you compare with everybody else because we know there's a huge range, and let's see how we can improve from there.
Thank you, Dr. Beattie. I'm now going to turn to the fifth and final study, and it's a feasibility study about transition coaching and how it may improve confidence and skills for young people with arthritis. Dr. Batthish, the first question I have is what is a transition coach, and how is that different from the usual care that youth currently receive?
So, health coaching as a concept has been around for quite some time in many other chronic disease models. So, a health coach in diabetes care helps the individual, regulate their blood sugar and know what to do if their sugars are high or low, and so forth. What we wanted to look at is specifically the role of a health coach during that transition period. So we termed that individual a transition coach. And in our study, it was a healthcare provider, and that could be a physiotherapist, a social worker, psychologist, who would connect with youth in between their clinic appointments as a touch point to see how are they doing with their disease, but also how are they doing with other aspects of their life as well, to get a sense of, where are their needs are at, and how can they support them, or potentially flag potential issues to their doctor before their clinic appointments.
So there's an interesting connection here to an earlier study that we discussed today, and that is we talked about some of these real life challenges that young people are facing and risks and lack of information. And I'm thinking about how that relates to, we looked at medications or stress, alcohol. What did you learn from this early study about how coaching can possibly help youth manage these real life challenges?
Having a transition coach has great potential because it's just one other touch point that the youth has with the healthcare system to seek out any potential guidance they may have or need with regards to some of these more sensitive topics that may not come up during their regular visits with their rheumatologist, family doctor, and so on. And so ensuring that the transition coaches are equipped with the right resources and information about potential interactions with their medications, or here are some online resources to help you with your mental health, can definitely help the youth get the information they need.
So incredibly important findings. And I think equally important and exciting is there are some next steps now based on this feasibility study in terms of what you and your team are going to be able to look at in terms of upcoming research.
Yeah, it's really exciting. So, as you said, this was a feasibility study, which is essentially a study to look at whether or not the intervention, the transition coach, is something that could be feasibly done and accepted by our participants. And are we able to run this study at a larger scale? And so, given that the study is now concluded, we have that information on hand to design the next step, which is a much larger scale study across multiple locations in the country to test out this transition coach role for youth with chronic rheumatic illnesses across the country. And so hopefully soon we will be able to get started on this project and start recruitment.
Fantastic. And we are going to continue to follow that story as it advances. We're really excited to be able to work with you in terms of helping promote this work. So I want to thank Dr. Beattie and Dr. Batthish, both of you, and truly amazing work. Congratulations. And to everyone watching, thank you. Bye for now.
Bye.
Thank